Back at uni, somebody probably told you that it was really critical that every time you see a new client, you start the first session with an extended ethics spiel. And in this ethics spiel, you go through things like confidentiality and note storage and when confidentiality might be breached and some of the negative outcomes that might happen from those sort of confidentiality breaches. Did you ever stop to think why? And is it all that important? And if it is so important, why don't GPs do it? When was the last time you went to any other health professional and they did an extensive spiel about privacy and ethics? I'd like you to think about this introduction from a client point of view. Now remember, they probably booked in to see you weeks, maybe even months ago, and they've spent all day, probably all week, thinking about this first session and what they want to say. What are their hopes for therapy? What do they think about you? What are they worried that you might be thinking about them? And what are their goals and their ambitions? And how are they going to tell their story in a meaningful way? What impact do you think it has while they are bursting to tell their story and we launch into what sounds like a product disclosure statement from the back of a drug packet? I've tried to dig into this question a little bit with some of my supervisees in recent times. And when I ask them why do they do it and what do they hope they're going to get out of it, what they normally say is that they imagine a situation far off in the future where they are in trouble. A complaint has been made to the Ombudsman or the APS or some other organisation, and they will be able to defend their actions by saying, but I verbally talked to the client about confidentiality beforehand. Now I'd like you to imagine, in that situation where a complaint has been made, what additional protection do you imagine that that verbal consent is going to give you? You'll have the written consent from your client information and confidentiality form. Did you document in your notes that you verbally consented people? And if not, what is the value of the verbal consent in the first place? Because as we know, verbal contracts are not worth the paper they're written on. If your client doesn't remember you saying it and you didn't write it, then it didn't happen. So I ask again, what is the value of this extended verbal consent? Now, please don't get me wrong, there are some clients that it is absolutely important to do that. People for whom English is a second language, people with low literacy, people who might have an intellectual impairment. Absolutely, you should be going through confidentiality with them verbally to make sure they understand it. But importantly, when you do that, that is for their needs. When we do it in a stock standard way, for everybody, that's more about meeting our needs and managing our anxiety. Remember, you only get one shot at a first impression, and I want you to think carefully about what your client needs in that first session, because I know they are thinking carefully about whether they're going to come back for a second session. Disagree with me if you like in the comments, but for now, thank you.